Mrs. Lee is a 45-year-old female. She has not been feeling well for the past few days, and last night her symptoms got worse. She has been taken to Grizzly Medical Center by her daughter Anna. The nurse tech is taking her vital signs. All right, Mrs. Lee, please come here. And can you please step on the scale here? Very good. Please have a seat right here. Alright, can you confirm your name and date of birth, please?
Yes, my name is Elsa Lee, and my date of birth is 31st January 1977.
Very good. Let me take your vital signs, and after that, doctor will see you, alright? Let me check your temperature as well. Yes, it seems you have a little fever. Alright. Alright, let me check your blood pressure, please. Which arm is okay?
Any?
Alright, I will take on the right arm, please. Very good. And can you please uncross your legs? You can relax your hand. Perfect. Your blood pressure is a little low. Is it okay if I check your blood pressure and ask you to stand up?
Yeah.
Alright, give me one moment, please. Alright, please stand up. Alright, please have a seat. Seems that your blood pressure is a little low. Do you feel lightheaded when you are trying to stand up?
Yes, I do.
Alright, nurse will see you shortly, so I will ask you to please come to this next room and nurse will see you, okay? So please come with me. The nurse is asking Mrs. Lee about her current symptoms and past medical history.
Hello. My name is Majenta. I'll be your nurse today.
Hello.
Nice to meet you.
Nice to meet you.
Nice to meet you. Do you mind verifying your first, last name, and birthday?
Elsa Lee, 31st January 1977.
You provided that. What brings you in today?
I have been throwing up since last night, and I feel really weak.
Perfect. And you mentioned that you've been vomiting. How many times have you vomited last night?
About 3 times, and I feel lightheaded when I try to stand up, and I also had some stomach pain for about 3 days now.
Have you noticed any unintentional weight gain or weight loss in the last few months?
I have lost about 15 pounds in the last 6 months.
She has not been showing any interest in her hobbies. She seems weak, and she has also been eating less nowadays. I found her unconscious in the bathroom, and after waking her up, I wanted to call the 911, but she insisted that I take her to the ER myself.
Okay. And then besides that, do you have any other concerns today?
My mom has been very weak for about 2 weeks, and her skin color has also changed the past few months, and she hasn't been getting sun exposure.
Okay. Thank you. And then tell me more about the dark spots that you've noticed on your skin.
I see them on my face, elbows, ankles, and my knees. Also like my scars, they seem a little darker after healing than before.
Okay. I see. So now regarding your family history, is there anyone who has chronic illnesses like blood pressure, diabetes, or a history of cancer?
My late mother had type 1 diabetes.
I'm sorry, Mrs. Lee, for your loss. Thank you for your patience, okay? So I have all the information that I need, so the doctor should be in shortly, okay? And it was great meeting you.
Good to meet you.
Great meeting you. I should be back in shortly, okay?
Mrs. Lee is brought to the examination room to be seen by her physician for a general and systemic physical exam.
Hello, Mrs. Lee.
Hi.
My name is Dr. Rivera. I'm here to check you out today. What brings you in to see us?
So I haven't been feeling really well lately, and if you can please help me out.
Okay. So my nurse tells me that you've had some vomiting, some weakness, and skin changes recently.
Yes, doctor, please help me.
All right, Mrs. Lee. To better assist you, we're gonna do a physical checkup. Are you okay with that?
Yes, I'm okay with that.
So I'm just gonna look at your eyes. Okay, and then if you would open your mouth. Okay. Get your gums. And then lift your head for me. All right. Okay. All right. Take a listen. Good. Excuse me, it might be cold. Take a deep breath. At any point you get dizzy, please tell me. Okay. Everything sounds clear. We will need to do a few blood samples, a chest x-ray, and potentially a CT. Luckily, we can do those today. Once we have the reports of the lab work, we'll have a clearer picture of what's going on with you. Do you have any questions?
I don't think I do.
All right, in that case, first the lab technician will come in to draw some blood samples, okay?
Okay.
The lab technician is here to get some blood samples from Mrs. Lee.
Hello, my name is Shailee. Can you verify your name and date of birth?
Yes, my name is Elsa Lee, and my date of birth is 31st January 1977.
Thank you. I'm gonna do the imaging. I'm the technician. I'm here to take your blood sample today. Do you have any questions?
Yes, I do have a question. I forgot to ask the doctor, what were the blood tests for?
Well, the doctor would like to do some blood work in order to check the ACTH level. This test will determine whether your adrenal gland is functioning adequately or not. I also need to check your plasma cortisol levels. I will take some blood sample to check your complete blood count and electrolyte. I would also collect the blood sample for thyroid and calcium level as well as check your kidney function. Among those blood samples, one will be used to check your blood glucose level. Once the results are available, the doctor will come back and she will discuss the results with you.
Okay.
Okay? If you don't have any question, can I take your blood sample?
Sure, which hand?
Okay.
Which hand?
After completing blood work and imaging studies, Mrs. Lee is seen by her physician to discuss about the lab results, diagnosis, and treatment.
Well, Mrs. Lee, it looks like your blood work came positive for a condition we were concerned about.
What condition?
It seems that you're suffering from Addison's disease. In this condition, your adrenal glands are being attacked by your own immune system, resulting in a deficiency or a lack of corticosteroid production. These are responsible for regulating your blood pressure and your energy status.
Am I going to die?
No, luckily, we have a lot of medications that can help with hormones.
Why is my mom's skin turning dark?
Well, Anna, your mom's kidney function is a little bit low, which could be due to dehydration. Also, ACTH levels are very high. That's why your skin has dark spots around it. And this hormone stimulates her melanocytes, which are responsible for producing melanin, and they'll turn her skin darker. After taking the medications, the dark spots should recede. Well, Mrs. Lee, let's discuss some medications. Since your blood pressure is low and you have a severe deficiency in your adrenal hormones, you're going to be staying here to get a bolus dose of hydrocortisone and some IV fluids. We'll continue these medications until your blood pressure and your hydration status normalizes. We'll also give you some medications to prevent your immune system from further destroying your adrenal glands. And once those symptoms subside, we're going to change those medications to tablet form, so you're going to take them by mouth. You'll need to take those medications continuously, and after a month, we'll reevaluate your adrenal function and adjust your medication dose accordingly. The nurse is going to come in shortly to talk to you about the instructions of those medications and the follow-up. Do you have any questions?
No, I don't.
The nurse is teaching Mrs. Lee about her medications in referral to endocrinologist.
Hi, Mrs. Lee. I am back. Okay, so the doctor wanted me to go over some medications with you, okay?
Okay.
So there's some important things that you need to know. And you also have to follow up with some appointments. You will need to take your medication as instructed and don't stop, okay? Unless your healthcare provider tells you to do so. And then you also need to follow up with an endocrinologist to evaluate your thyroid function, as well as check your bone density routinely, okay? Do you have any questions so far on that?
No, I don't.
No? Okay, perfect. So also I want to give you an emergency alert bracelet, okay? You will need to wear this bracelet at all times. In times of stress, such as with the common cold or any teeth extractions, you'll need to increase your dosage of your medication. I'm giving you a complete guide telling you how to adjust the dose of your medications in those times of stress or the procedures that we mentioned. The doctor also prescribed an injectable hydrocortisone. Before your discharge today, your tech will show you how to administer it, and then you'll have the medication in case you need to take it orally because you're vomiting. Do you have any questions so far?
No.
Okay, thank you. And then can you please repeat the points that we just talked just to make sure that you understood?
Okay. I must take my medications as specified. I must follow up with my endocrinologist for my bone density and my thyroid levels.
Okay, awesome. So it sounds like you understand all your instructions. Just keep in mind, if you need anything else, don't hesitate, give us a call, okay?
Okay.
All right.
Thank you so much.
You're
Thank
welcome.
you.
Thank you for helping my mom.
You're welcome. You guys take care.